The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're going to be talking about open enrollment. Not Medicare open enrollment, because we've talked about that a lot, but we're also going to be talking about another open enrollment. That's the healthcare exchange open enrollment, which is going on right now. And if you're in the right age category, we want you to know all the information about this, so stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
Can you say ombudsman?
Ombudsman. Benson? Oobison?
Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Hi everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimi Everman, and as I said, we have a whole nother open enrollment to talk about today. And that's the open enrollment for the healthcare marketplace that a lot of people are using these days prior to going on to their Medicare. And so we want you to have all the best information that you can get, especially since it's going to be, the window for enrollment will be closing soon. We have with us today Olivia Ryuta. And Olivia, you're with the Montana Primary Care Association. And you've been working on this whole open enrollment marketplace program for almost from the beginning, right? From the beginning.
My first day at the Primary Care Association was the first day of the first open enrollment period. And if you remember back that far, the system broke. It didn't go as planned.
Yeah, it was pretty
challenging
hard.
times.
Yep, it was hard.
So we've come a long way since
You really
then.
have.
Yeah.
And so glad to have you here. But why don't you tell us a bit about that so that we can be real clear about which is which open enrollment?
Sure, absolutely. So I'm with the Primary Care Association, and we're the association of all the community health centers across the state of Montana. Our members are community health centers and urban Indian health centers. And as part of that work, since the beginning, we've been working on outreach and enrollment, really making sure that Montanans, right, whether it's patients in a community health center, but just anybody in a community who doesn't have health insurance coverage or has questions, that they have really kind of as much support as they need to understand what they're eligible for and to get through that process. So we've been doing this for a long time.
Right.
So it's open enrollment for the health insurance marketplace. So the health insurance marketplace, it's at healthcare.gov, and it's where just over 50,000 Montanans get their health insurance coverage.
And what does the typical age range tend to look like, Olivia?
Yeah, so most folks who are on the marketplace, they're adults, so they're usually over 19, or if they're 26 or over, they've aged off their parents' plan. And these are folks who don't get coverage through an employer, right?
Sure.
Most Montanans get employer-sponsored coverage either themselves or through a spouse. And so these are folks who, for some reason, they don't get insurance through their employer. Maybe they're self-employed. Maybe they're between jobs, and they are going on and purchasing a plan for themselves and their families oftentimes. But it's folks usually up to age 64. So
Right.
usually somebody is on the marketplace, and then once they turn 65 and become Medicare eligible, right, they would then transition off the marketplace and proceed with Medicare.
And we want to be just, again, very clear that you don't want both. You
Right.
don't
Yeah,
sign
you
up.
can't have both.
Exactly.
Right. So essentially, we work with a lot of folks, a lot of couples maybe where somebody is Medicare eligible, somebody is enrolled in the marketplace, and then once that person kind of ages into Medicare, then we give them information in transition and then work closely with our partners who are SHIP counselors around the state.
Sure, right. We love
love
the
SHIP counselors. Yeah, absolutely.
So is there anything sort of new for 2023 that we should know about?
Yeah, absolutely. And so there's about a third of the folks in Montana who are on our marketplace are between 55 and 64. So that's really important for folks who are older but aren't quite Medicare eligible. And so what's really exciting is there's been some affordability measures. We call them affordability measures, but basically what it means is the amount that somebody's going to pay out of pocket for their premium for many Montanans has gone down. The measure started during COVID. They got extended recently under some federal legislation. And we're really excited because what it means is that a lot of Montanans who maybe felt like insurance wasn't affordable, maybe they applied in the past, are really able to afford coverage, and people are able to get into a plan that not only meets their health needs, but they can also afford it each month, which is super important. So there's enhanced affordability measures, so those are going to continue throughout this open enrollment period. So again, anybody, if you're uninsured and you're like, I can't afford it, we're really encouraging everybody to at least do a calculator and see what they might qualify for.
Sure. Yeah.
And then there's some new measures there's some new federal rules for families, and this is a little complicated. But it's really exciting. So it's a new rule that allows family members of workers, where that worker is offered employer coverage, and so it's affordable for the worker, but that family coverage isn't affordable.
So that's a bit more. Yeah.
Yeah. So we've seen this a lot in the past. So the rule has changed, and what it means is that in a lot of instances, those families are going to qualify for financial help so that they can get access to an affordable plan as well. So it's a really exciting change. It's a little bit complicated to talk about, and the only way that somebody knows is to fill out an application to see if they qualify.
Right. So before we end this first segment, let's talk about how to get a hold of you guys. What do we do?
So we have lots of ways to get a hold of us. So we have a Cover Montana helpline. That number is 844-682-6837. And then our website, covermt.org, where if you put in a zip code, you can find somebody who can help you locally, and oftentimes you can sign up for an enrollment appointment there as well.
And when you say somebody to help you, what you're talking about is someone who's been trained and is in an ongoing way trained to understand what they're trying to help you with.
So they're certified, their help is always free, and it's always confidential.
Olivia, this has sounded more and more like SHIP, and I love it. Thank you. Thank you so much. We have a lot more to talk about, everyone. We want to give you some idea of how to get signed up, if there's any helpful help available, what kind of plans you'll be looking at, just all the nitty-gritty that you're really going to need to know to be able to walk through this. Don't go anywhere. Come on back.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
A decade of Montana 4th graders on Energy Share. If you're having trouble keeping your home warm this winter, Energy Share of Montana is here to help. We've helped thousands of Montanans who are having trouble paying their energy bills, and getting assistance from the friendly folks at Energy Share is only a phone call or Google search away. Energy Share is not a government program. It's neighbors helping neighbors who face energy emergencies. The Montana way. Call or visit our website today. Thanks to Energy Share, I'm cozy like a bear.
Hey folks, welcome back to Aging Horizons. We're here with Olivia Riuda from the Montana Primary Care Association talking about the other open enrollment.
Yes.
So Olivia, we've been talking about the fact that this open enrollment is for the healthcare market, for folks who are 64 and under that. And just a little bit about how people get signed up for that, etc. But let's really get into the nitty-gritty here. How do you even get started? How are things? How do you even start getting covered on this?
That's a great question. So the health insurance marketplace in Montana, our marketplace is at healthcare.gov. It's a website, and the whole goal is it's a place where you can do kind of an apples to apples comparison for health insurance coverage. It hasn't always been that easy to shop for health insurance coverage. And so it's essentially...
But hasn't it come a long way?
Yeah.
I feel so proud that we've come this far.
Yeah, and it's... So it's one application. So let's say you have a family, maybe not everybody needs coverage, maybe somebody's eligible for Medicare, but a spouse needs coverage. It's one application, and essentially what we do is we sit down with somebody, right, and we walk them through that application. So we answer all the questions that they might have. Some of the questions are just about health insurance in general and how to access care, right? And then some of them are about, like, what does this question on the application mean? So as much or as little support as someone needs, we're walking them through that application. The application is going to automatically kind of send the people in that family who need coverage to the right place. So a lot of folks in Montana are eligible for expanded Medicaid. So if somebody were income eligible for Medicaid, it would happen automatically. If anybody has minor children in the home and they're eligible for Healthy Montana Kids, that would happen automatically. And then if they're marketplace eligible, that happens automatically. So you fill out the application and then it says, okay, Kimmy, you qualify for, let's say, $200 a month in a tax credit. And then what you're able to do is take this $200 a month and go shopping with it and look at all of the plans available to you. So we're having conversations about what can you afford, right? Like what
Okay.
can your family afford for you to pay in a premium each month?
Sure.
But then you have a bunch of options. So there's 3 health insurance carriers, Blue Cross Blue Shield, the Mountain Health Co-op, and Pacific Source. These are the plans you're buying on the health insurance market.
In Montana.
In Montana.
Gotcha.
Right? So we have 3 carriers. And then you're looking at all those plans and figuring out where do you live, what providers do you see, where do you like to seek services, what prescriptions do you take, kind of going through that whole gamut of how folks access care and their health needs.
Right.
And so what we do as enrollment assisters, right, we're navigators or certified application counselors, is just help folks through that process. What we know is that people are much more likely to enroll in coverage if they have their questions answered.
Sure.
And the good news is that most Montanans can find somebody locally who can help them through that process. But we also have, after COVID, we do so much both virtually and also over the phone. And so we have a lot of virtual and phone capacity as well. If somebody's like, we have this a lot where somebody lives in the same town and they're like, I don't want to drive. I'll just give you a call.
Amen.
We can do this over the phone. And so we're able to kind of help folks usually in whatever way is best for them.
Yeah.
So the timeline we're looking at for open enrollment is the open enrollment period. If you want coverage by January 1st, you have to enroll by December 15th.
Okay.
If you enroll after December 15th, you have until January 15th to enroll. But if you want that coverage January 1st, you have to enroll by December 15th.
So if you don't enroll until January 14th, let's say, when does your coverage start
On
then?
February 1st.
Okay, February 1st, the first day of the next month. Okay.
Right. And so if you don't enroll during open enrollment, there are certain life changes where you could enroll afterward. Right, but in general, most folks need to enroll during open enrollment if they want coverage in 2023.
Right. And you said that it can be done by phone. You can do virtual types of appointments, or you can do in person. And so the person that is looking for this wants to maybe give a call or go to the website.
Yep. So they could, you could start, if you go to our website, covermt.org, and you go to Find Local Help, you can put in your zip code and look for folks who are closest to you.
Oh, nice.
Right? You'll see what organization they're at. You can say, hey, I love working with this hospital. I'm going to go to the person at the hospital. You can kind of see who is in your area.
And when you say who is in your area, you're talking about one of those very highly trained navigators who is a completely objective person.
Right.
They have nothing to sell you.
So they're certified application counselors or navigators. You can work with either. And they're trained, certified. They're free as always. Their help is always free, it's confidential, and we are not allowed to have any opinion on what plan you should select, right? So it's really giving people information.
Nor would we want to.
Right.
Yeah, exactly.
It's just giving folks information so that they can pick the plan that's best for them.
Right.
So you can go to our website. You can also call our Cover Montana helpline, 844-682-6837. And we also have Spanish-speaking folks on the helpline. If anybody would rather do the application in Spanish, they can do that there as well.
Sure. And there's some special considerations for tribal communities.
Yes. We might have to wait. I think
because it's big.
It's big. Well, so let's talk about that in the next session, but we want to make sure enrolled members understand the special considerations.
But so then let's just say one more time, we'll put it on the screen. Go to the website, call the 1-800 number, and just say, I really need some assistance in figuring out this open enrollment, and can you put me in touch with somebody? And they will be like, yes, we
Absolutely.
are. If it isn't them, they will be happy to get you to someone.
We're moving people around all the time, figuring out what's best for them and who they can enroll with.
Yeah, and I think it's important for people to understand when we say that, we're looking, as you said, to get the person with the right person to speak to. So if you get moved once or twice, that's okay, because we're getting you to the right person, right?
Yeah.
Okay, so folks, we got a big one coming up, and that's those tribal considerations. So please stay with us. We have so much more to talk about.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Hi everyone, welcome back to Aging Horizons. We're here talking with Olivia Riuda today regarding the open enrollment, which is for the marketplace, the health insurance marketplace for folks that are under Medicare age. Let's start with something we left from the last segment, Olivia, which is that there's some special considerations for tribal communities under this.
Yeah, so as part of on the health insurance marketplace, there's some special considerations for folks who are enrolled members of federally recognized tribes.
Okay.
And it depends on your income, right? So for a lot of folks, enrolled members may qualify for a zero cost sharing plan. Okay. So, right, somebody's able to select a plan, utilize a tax credit, and then once they have that plan, they essentially don't have cost sharing if they're receiving covered services kind of in their plan network.
So what you mean is they don't have to hand over a check.
Right. Right. When you read that plan document, it's like to see your primary care provider, $0. To see a specialist, $0.
Right.
It's like a bunch of zeros.
Right.
Which is really great because it means that there are very few barriers to access care when and where somebody wants to access care. If enrolled tribal members are above eligibility for that portion, there's also limited cost sharing plans, which essentially allow folks, if they originate care from IHS, Tribal Health, or an urban Indian health center, if they originate care there and receive referrals, then they have limited cost sharing regardless of what their kind of plan says for other providers. And so there's some specific provisions I think that are really important, but it's also important to note that if folks are not enrolled members of federally recognized tribes, if they're descendants and they're not enrolled, descendants need to pay attention to the timeline of open enrollment because they're going to need to get covered by that January 15th date as well.
Okay, so let's put the number up again.
Yep.
Another really great reason to sort of make contact with one of the navigators or helpers on your side so that they can get that question answered.
Yep, and we have our navigator team in state. We have a number of folks who are working in tribal communities, who are members of tribal communities, and so if anybody wants to work directly with a member of a tribal community to do their enrollment and ask those questions, we have those navigators who are ready and able to help.
Super.
Yeah.
And so that just sounds like pretty easy. We'll put up the number again in the website. You just check in and take a look at what's available. And really, the biggest thing here is really you make a choice. You get to decide. You are empowered as to what plan's going to work for you, what financially will work for you. And no one is telling you you must have this or this.
Yeah, and if someone sat down with us, and this happens, and somebody says, well, I don't think any of those are affordable, or I'm going to decide that I don't want to be covered right now. Like, that's fine. There's no like pressure to buy, if you will. It's really giving folks the information and tools they need to make the best decision for themselves and their families.
Right, because I would say that many of us probably think, oh, I couldn't go a day without health insurance. Well, maybe you could, and maybe if there was something more important in your life that you had to make a decision about, this is one of those times when you get to make your own decision.
Totally.
So let's move into the sort of public health emergency on that federal level, because we've been talking about that a little bit. And of course, we're talking about COVID and some of the other things that go along with it. What say you about that?
So some of the work that we've been up to is really talking about what's going to happen to folks who are enrolled in Montana Medicaid, any kind of Montana Medicaid, or Healthy Montana Kids once the emergency ends. Essentially, the kind of short version is that the state hasn't been doing redeterminations since COVID started, right? And that's part of the plan. We, make sure that folks have access to care during the public health emergency. But once the public health emergency ends, we're going to have to start this kind of redetermination process with all of the folks who are enrolled in some kind of Medicaid or Healthy Montana Kids, which is almost 300,000 Montanans. And so, to prepare for that, and we don't know exactly when it's going to happen, we're encouraging folks to update their contact information, right? To know that changes are going to come at some point, but the only way that they're going to know and get that notice is if the DPHHS, if Montana Medicaid has their contact information, their correct contact information. And so to do that, you could call our 844-682-6837. Our team can help update contact information for folks. Somebody also can go to apply.mt.gov directly, and on the top there's a link to click on, a very simple form. I promise it'll take you 1 minute to update your contact information, and just make sure that once we start sending out notices for folks enrolled in Medicaid, that folks actually get those notices.
Right. And it'll just, it's not about sneaking around looking at people's stuff. It's about making sure they get what they need on time. Because we have the correct information on file for them. Correct?
Absolutely.
So, Olivia, for one thing, thank you so much for all this great information today, because I really do think we hear open enrollment and all I ever think is Medicare. So I'm so glad you came to talk about that. But in our last few seconds, is there any sort of final message you'd like to get out to folks?
So the first thing is that open enrollment ends January 15th for the health insurance marketplace. Most Montanans qualify for financial help. So if you're unsure, go ahead and see what you qualify for.
Can't hurt to try.
It can't hurt to try. And that free confidential local help is available. You don't have to do it alone. If you have any questions, you can work with somebody and they can help you as much or as little as you need.
Yeah, and let's also mention that there's no shame in looking for someone to help. Boy, I need technology help all the time. So if someone needs something, they can just give a call.
Absolutely.
Olivia, great having you with us today.
So much.
And thanks for all the great information. And folks, thanks for being with us, and come on back next time to Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.